Good morning to everyone. Hi viewers and my dear students. Sorry for the delay due to technical inconvenience. Now we are starting our live section. During this live section, detailedly we will discuss about breast cancer. Hope this will be benefited for all our nursing students. And this topic you can see in our gynecology subject and medical surgical nursing also. Today on this live section, we will see the overview of what is breast cancer and its introduction, what are the causes and risk factors of breast cancer, and what are the stages, types of breast cancer, and the screening and diagnostic modalities and management of breast cancer, and the prevention and nurses' role in breast cancer. So let us start with our live class. So you all very well can watch this online class from the channel rgcsk.edu. So first we will see the introduction of breast cancer. Breast cancer, it is one of the leading and life-threatening condition comparing to the men for the women. It's a problem for global wise and for the India also. If you see the globally, 1 in 9 women are getting with breast cancer. And in the India, 1 in 28 women are getting breast cancer. And comparing to the developing and developed countries, the incidence of breast cancer is more in the developed country than developing country like our India. But the survival rate of breast cancer and the mortality is less in developed countries. But in the developing country, the survival and mortality rate is higher. So why, when we think early diagnosis, and we have to take more prevention aspects, and if we are doing an early diagnosis and treatment modalities, 90 to 100 percentage of breast cancer can be cured and they can live a good uh, healthy lifestyle. So here we will see what is the anatomy of the breast. So all of you have studied breast anatomy in your first year. Just we will revise. Breast is a pair of exocrine gland that is present on either side of the chest wall, and it is attached to the pectoralis major muscle. In the breast, if you see, consists of lobules are present. So the lobules inside the breast, milk will be secreted. Myoepithelial cells are there for the contraction of that breast ducts, and it will be connected with the lactiferous duct. The milk has to be carried from the lobules to the nipple area through the lactiferous duct. And the lobules, more than 15 to 20 lobules will be present in the breast. And the breast consists of so much of connective tissues, and collagen and elastin will be present in the connective tissues, and this will be supported by fatty tissues also, and consists of copper ligaments, Cooper ligaments, that is present and attached to the chest wall. And the breast will be supplied by blood vessels such as arteries and veins, and it consists of lymph nodes and nerve supply. So this all you will be studied in your first year. So next we will see about what are the tumors that present in the breast. Breast consists of breast can be formed of different type of tumors. In that we will discuss about benign and cancerous one. What is meant by benign? The tumor that is present in one part of the area and doesn't have any spread or metastasis, it is known as the benign type of tumor. So benign type of tumor, mainly in the clinical type you can see like cyst or fibroids that is present in the breast. That is not much harmful for the women. And another one is metastasis. So in our today live section, we will see about the cancer. The cells are proliferated and it will be spread or metastasis to one part of the area to another part of the area. So that type of tumors are known as the malignant tumors or cancerous tumors. So in our class, we will see about the breast cancer. So we will see what is the meaning of breast cancer. So breast cancer, the in the breast tissues are the cells. The cancerous cells are formed, then it is known as the breast cancer, and it can be spread from the breast cells or the tissues to the lymph nodes and even to other part of the organs. So that is known as the breast cancer. So breast cancer, in all the women, there is more risk for getting the breast cancer. We will see what are the causes and risk factors of breast cancer. Causes mainly, we can tell it as an unknown etiology, and they have so much of risk factors of modifiable risk factors and non-modifiable risk factors. So we will see what are the risk factors. First one is age. Age wise, if the woman in our Indian setup, if it is more than 45 years of age group, then they are more risk for getting the breast cancer, or we can tell to 50 to 70 years of age group globally. And second one is sex. I told female are more prone for getting breast cancer, that is 80 to 70 to 80% than the male. And next one is the women menstrual history. Early menarche. If the girl attained menarche, that is the first menstruation, before the age of 12 years, and late menopause, if the woman attain cessation of menstruation or stoppage of menstruation after 55 years of age group. So these two groups are more risk for getting the breast cancer. And next one is the women having the history of any hormonal supplements, like if they are taking oral contraceptive pills, that is estrogen dependent or progesterone. And another one is hormone replacement therapy or menopausal hormone replacement therapy. So these groups of women are risk for getting the breast cancer. And next one is family history. First degree mother's family history. If suppose the mother is having breast cancer or sisters is having breast cancer in their family members, the women are more risk for getting the breast cancer. And next, when we are discussing, if the women have already any other type of cancer, such as ovarian cancers, uterine cancer, or previously she had any breast, either one side or both the side, they have done any surgical or radiation. So again, repeatedly, they can have the history of getting the breast cancer. And next one is nulliparity. If they don't have any children, if they don't have any children in their lifetime, then they are more prone for getting breast cancer. And another one is if they have the child after the age of 35 years. If the woman is delivering the child after the age of 35 years, they are also risk for getting breast cancer. And regarding the breastfeeding, if they don't have breastfeeding throughout their lifestyle, that women are more risk for getting breast cancer. So we will advise the women to give a prolonged breastfeeding for their child during the delivery time. Next one is they have any lifestyle problems. Lifestyle problems like sedentary lifestyle, not doing any exercises. And this can lead to obesity. Obesity also one of the risk for getting breast cancer. So sedentary lifestyle that can lead to obesity, that women are risk for getting breast cancer. And other lifestyle like if they are having a consumption of alcohol, more amount of alcohol per day if they are taking, then they are having the risk for getting breast cancer. And another lifestyle, if they are using smoking or tobacco, there is a risk for getting breast cancer. These are the lifestyle habits. And working long duration of night works, there is some research studies, they are also risk futures, there is a risk for getting breast cancer. And another one is history of genetic mutation. So if their gene like BRCA1, BRCA2, like that gene type of peoples, this gene can lead to cancer in their future. So in any family history, genetic history, they have this type of gene. For them also, they can check whether in their body this type of expression of gene is there. That group of people are more risk for getting the breast cancer. And another one is density of the breast. If the breast is more bigger in size, when there is less fatty tissues, more type of glandular tissues, that type of women are more prone for getting the breast cancer. So these are some of the risk factors, includes modifiable and non-modifiable risk factors that leads to breast cancer for the women. So hope you are clear about the risk factors. And next we will go to what are the signs and symptoms of breast cancer. So if you are a woman, if you have the breast cancer, the woman will have what are the complaints or signs and symptoms. So as a nurse, we should know about the signs and symptoms, and we have to teach the women who are coming to our clinic how to note the signs and symptoms. So first, mainly the woman has to see there is any change in the size, shape and symmetry of the breast. And next one is any color change of the breast, skin color change, any type of reddish or any type of orange peel or pitting type of changes is there in the skin, any edematous, warmth is there, any scaling of the skin, and any type of crackled of the skin. Okay, so these are the main changes. And another one is lumbar nodule. If there is painless lumbar nodule, so many women are hesitate to come to do the clinical examination. So we have to advise, if they are finding out any lump, painless lump, without shame or without shyness, they have to come to the clinical area to find out what type of lump is there. So most of the 60% of death in India due to breast cancer because of the delay of identification of breast cancer. If we are early detecting, finding out a lump and they are coming to the hospital, early they are detecting the lump, so we can go with a curable or treatable condition. If they are coming with the late stages and it is spreading to all other organs, so mortality will be higher for the women. So that you can remember, a lump, painless lump that is present on the breast, so that also one of the sign. And another thing is retract or inverted nipple. So previously they have an inverted nipple, suddenly the nipple is inverted, or color changes of the areola, or discharge other than the milky discharge that is coming from the nipple, if it is a serous fluid or if it is a blood tinged fluid or foul smelling fluid that is coming out from the nipple area. So that also indication they can go for assessing the screening for cancer. So these are the main signs and symptoms that is present in the breast if they have breast cancer. Next, we will see what are the types of breast cancer. So cancer, that is a proliferation of the cells. More number of cells will be growing in a particular region and it will form like a lump or nodule, and this can be present in the particular area, or it can be spread from one part of the region to another part of the body, and even it can be life threatening to the patient. So here we can see mainly two types of breast cancer you can remember. One is invasive type of breast cancer, non-invasive type of breast cancer. In non-invasive type of breast cancer, the cancer will be present in situ, and it is a pre-cancerous type, and we are identifying this type of cancer. Earlier we can do some surgical management and medical management, we can cure the disease. This cancer, this non-invasive type of cancer also can be changed to invasive type of cancer. So what is invasive type of cancer? In the invasive type of cancer, the number of cells proliferation will be increased and it will be spreading to one part of the region to another part of the region of the human body. So if the cancer is present in the breast, it can be spread to the lymph nodes and it can be spread to the different organs such as lungs, liver, brain and uterus. So like that it can be happen. That is known as the invasive. Invasive type of cancer, it is a metastasis cancer. It is little life threatening to the patients, and surgical managements and conservative therapies can be done. So first we will see non-invasive type of cancer. In the non-invasive type of cancer, you can remember two types, that is ductal breast cancer in situ. So ductal breast cancer situ means the cancer is present in the duct of the breast. ductal tissues of the breast, and it is not metastasis. And another one is lobular cancer in situ. In situ means it is placed in one portion of the lobe. So when they are surgically removing that particular area, affected area can be removed, and the edge of the tissues, margin of the tissues of the normal tissues also can be removed, and they can go with the radiation therapy, and further chemotherapy can be given according to the nature of the breast cancer. So next one is these are the main two types of non-invasive type of breast cancer, that is ductal cancer in situ and lobule cancer in situ. So that is the cancer that is present in the particular part, not metastasis. Then another one is invasive type of cancer. Invasive type of cancer, the characteristics is the cancer can be spread to either to the lobe and to the nodules and to the other organs of the women's body. So first one is ductal carcinoma. So 80% of the breast cancer, when you see ductal carcinoma is the major concern and commonest one for the women. In the ductal carcinoma, the cancer is present in the ductal tissues, and even it can spread to the either part of the breast tissues, to the lymph nodes, and to the other organs of the human body. And next one is lobular carcinoma. So here the cancer will be present in the lobules, and it can be spread to the breast tissues, lymph nodes, and other part of the organs of the human body. And another type of carcinoma is inflammatory carcinoma. That is an advanced type of carcinoma, and it can be leads to life threatening for the women. Here this is the rarest one also. Here, like inflammation type, the breast will be very much swollen, tenderness, shiny, redness, orange peel color will be there, and very painful will be there for the woman. That is the inflammatory type of breast cancer. So other type of breast cancers also is there, like hormonal dependent or receptors breast cancer. In the hormonal dependent or receptors, in their women's body, more amount of that particular hormone will be produced, and this will be sensitive to the development of breast cancer, such as the estrogen receptors breast cancer is there, progesterone receptors breast cancer is there. So if the woman body is producing more amount of this hormones, so then in the breast tissues they have the there is a growth of cells of the breast will be more according to the dependent of estrogen and the progesterone. So that we can tell as the hormone dependent breast cancers. And another one is HER factor, HER2 dependent cancer, that is the human epidermal growth factor. So if the human epidermal growth factor is present in the women body, in the breast tissues, that will be sensitive for the production of cancerous cells. That is one type of protein. So HER2 type of cancer. So this also can be present in the women body. So when we are doing diagnostic evaluation, the doctor or the physician can identify what type of cancer is there for the women, whether it's a hormonal or whether it's a protein or whether ductal or inflammatory or lobular type of cancer. Next one is triple negative type of cancer. In the triple negative type of cancer, here three factors they can do the screening, whether they have estrogen, the next one is progesterone, that these two are hormonal, and HER2 factor, that is human epidermal growth factors. If three factors are negative and some other reason they are getting the cancer, so that is known as the triple negative type of cancer. So these are the different type of invasive type of cancer. And Paget diseases is that this Paget diseases mainly happening in the nipple and the areola, that is present in the breast. So hope you understood some of the overview of cancer, different types of cancer that is present in the breast. Next we will see about what are the Stages of breast cancer. So stages of breast cancer, mainly stage 0 is there. In the stage 0, the cancerous cells that is present inside the breast, any type of duct or lobes within that area, the cancer tissues will be present. So this can be, if it is early identified, this can be removed and treatable for the person. And second one is stage 1. In the stage 1, the breast cancer, the size will be determined. The size will be less than 2 centimeter and it will not be spread to the lymph node. And stage 3, next one is stage 2. Stage 2, the size of the breast cancer, the diameter will be more than 2 centimeter and this can be spread to the 1 or 2 or 3 lymph nodes. Then it is considered as the stage 2 breast cancer. So these are considered as the early type of breast cancer. And stage 3 and stage 4, it is the late breast cancer that is very much deleterious, harmful and threatening for the women. In stage 3, the size of the tumor or the nodule can be more than 2 centimeter to 5 centimeter and that can be spreading to more number of lymph nodes. That comes under the stage 3. So here subcategories also is there, how it is spreading to the axillary lymph nodes. And next one is stage 4. In the stage 4, here the tumor size will be more than 6 centimeter and it can be spread to more number of lymph nodes, clusters of lymph nodes and even to the other organs of the body like liver, lungs and kidney or brain, bone. So these all can be affected for the woman. So these are the major stages of breast cancer. As a nurses, we have to educate the women, those who are coming for the clinic, to find out what is the type of breast cancer and what is the stages of breast cancer. The treatment is depend on according to the stage, according to the type of the breast cancer. So if we are early identifying the breast cancer, then our treatment can be started and we can cure the disease. If we are identifying type and breast cancer in the later stage, it's very difficult to give care for the patients. Even they can go with death even during their later stages. So that's all about the stages of breast cancer. Next, we will see what are the screening and diagnostic modalities of the breast cancer. Hope you knows about the some of the screening method of breast cancer. As a woman, we all will get an awareness month, October month, no? Everywhere all over the globally and India, we are celebrating. That time they will be giving so much of awareness about screening of breast cancer. So here first one is breast self-examination. As a nurses, we should know about the breast self-examination and we have to educate all the women, those who are coming to the clinic, how to do the breast self-examination. So this breast self-examination can be done first week of the menstrual, after the menstrual cycle, and they can be done after 20 years of age till their old age time. Okay, here how they can do, when they are doing the shower, they can do the self breast examination, or sitting position or lying position, they can do the self breast examination. Inspection has to be done and palpation has to be done. They can stand in front of the mirror, put the arm up or put the arm on the hip, and they can see the breast, what is the size, shape, symmetry of the breast, any color changes in the breast, inverted of the nipple, or any retraction of the nipple, or retraction to inversion of the nipple, or scaling of the nipple, or any discharges from the nipple area. They can assess, and they have to do the palpation with their finger pads. They can do the palpation in the circular manner and they can find out any lump is there, painless lump is there or painful tenderness lump is there, any swelling is there, any nodule is there, that can be assessed. And they have to squeeze the nipple area and they have to see what is the discharge that is coming from the nipple. So this regularly they can do the breast self examination. Each month they can do it. So this, as a nurses, we have to teach the women, those who are in the community area or in the clinical area. Second one is clinical breast examination. If suppose they are not identifying a regular breast self-examination, they have to come to the clinical 3 months once, and the healthcare practitioner, either the nurse or the doctor or physician, they can do the clinical breast examination either in the sitting or the lying down position, and they can find out any abnormality or changes in the breast. Next, diagnostic modalities. This is the cheapest and simple method to identify breast cancer. And another one is they can do the mammography. Mammography, low beam X-rays can be sent in the breast and they can identify. So the mammography, clinical mammography is there, diagnostic mammography is there. So this mammography can have an accurate result in identifying the breast cancer. Other type of diagnostic modalities like ultrasonography can be done and MRI can be done. And next step, sometimes after the breast examination, that is self breast examination, clinical breast examination or mammography, these many diagnostic measures, they are not finding it. Then next step, very important, is biopsy. In that, different types of biopsy is there. Fine needle biopsy. Needle can be inserted on the breast with the guidance of the ultrasonography, and small tissues or the cells can be collected and they can send for the diagnostic evaluation. That is fine needle biopsy. Then core needle biopsy. Group of cells or tissues can be, or core tissues can be taken from the breast with the guidance of mammography or ultrasonography. They can do the core biopsy. Vacuum assisted biopsy also is present. And another type during the they can do as excision and incision biopsy. So that has to be done on the operation theater and they can do the biopsy. Excision biopsy, they can do the incision and remove the tissues and close the breast area. And incision biopsy, small part of tissues can be taken by the incision. After the procedure, they can close it. And this can be sent to the diagnostic and they can find out what type of cancer is there. So these are the different type of diagnostic measures. And triple, they can find out the hormonal receptors is present, like estrogen and progesterone, and human epidermal growth factor HER2 is there, and genetic test can be done if the women like BRCA1, BRCA2. So these are the some of the diagnostic measures. Next, we'll go with management. Management, mainly of the surgical management is there. Surgical management, first one is lumpectomy. So here, what the nodules are lump, they are identified, that can be incised and excision can be done. So the tissues of the lumps can be removed along with the marginal tissues. Normal tissues can be removed. Later, they can go with the radiation therapy also. Partially is there, symmetrical lumpectomy also is there. Next one is mastectomy. In lumpectomy, they are doing conservation of the breast. If it is in the early stages, then they can go with the lumpectomy. Mastectomy, if they are finding out, they are removing the entire breast. Simple mastectomy is there. In that, glands, ducts, and the breast tissues and the nipple areola, everything will be removed. If they that comes under the simple mastectomy. Then next one is radical and modified mastectomy is there. So in here, along with the simple mastectomy, the lymph nodes can be removed, the axillary lymph nodes. And along with the simple mastectomy, chest wall, the tissues of the chest walls also can be removed. So these are the different type of mastectomy. So simple mastectomy is there, modified mastectomy is there, radical mastectomy is there. Then next one is lymph node resection. So which lymph node is present, the lymph node can be removed from the body. So these are the different type of surgeries. And breast reconstructive surgeries are there. In the breast reconstructive surgeries, from the own human body, tissues can be taken and it can be implanted from the abdominal muscles or thigh muscles. that can be taken an implant, or other implants are there, silicone implants are there, they can be placed on the breast. But when they are going with the implants in future, because of the implant also they can have the breast cancer. So these are some of the surgical management. Next we will discuss about medical management, like chemotherapies are there. Chemotherapy, neoadjuvant chemotherapy is there, adjuvant. So before surgery also chemotherapy can be given. After surgery also chemotherapy can be given. So chemotherapy, it is the measures to kill the cancerous cells. So this chemotherapy, different medicines will be there. Combined group of drugs also can be given. Single group of drugs also can be given according to the type and nature of the breast cancer. So chemotherapy, fluorouracil is there, methotrexate is there, cytotoxin. See, these are some of the drugs they can give during the chemotherapy procedure. Another important measures in breast cancer is radiation therapy. So radiation therapy, this is one of the radiations can be sent to the breast tissues, and this will kill the cancerous cell. In radiation therapy, two types of radiation is there mainly. External radiation is there, internal radiation is there. External radiation, external beam rays can be sent to the breast in all the areas, and the cells can be destroyed. And internal radiation therapy, it is known as the brachytherapy. Here, implant of radiations can be kept on the breast for a duration according to the physician order. So slowly the radiation will be occurring to the breast, and the breast tissues will be destroyed. So these are the major two types. And during the operation, surgical radiation therapy, during the operation also, after finishing the procedure, they can give the radiation therapy in order to that is external beam radiation therapy, in order to kill the cancerous cells or destroy the cancerous cells. These are the different types of radiation. Radiation also, according to the type and nature of the breast cancer, they can decide whether prior surgery they have to give the radiation therapy, or after surgery they have to give the radiation therapy. So prior surgery, why they are giving chemo or radiation therapy? To reduces the size of the breast cancer size. Then they can go with the surgical repair. Or after surgery, they can give the radiation therapy in order to prevent the further growth of the cells. Next, another one is target therapy. So in the target therapy, like HER2 type of breast cancer, they can give the protein type of measures in order to reduce. Monoclonal antibodies can be given in order to reduces the reception of HER, and this will be combined with the HER receptors. These antibodies will be combined with the HER receptors, and it will be blocking the further development of cancer for the patients. And another one is immune therapy can be given, and nutritional supports can be given for the women. So these are the major treatment that comes under the breast cancer. So the doctor will be deciding according to the stage and according to the nature. So what type of treatment is preferably needed for the women with breast cancer, whether with the surgical and chemotherapy, surgery and radiation therapy, or combined therapy, or target therapy can be given for the women. Next, we will discuss about what are the preventive aspects of breast cancer. Prevention is better than cure. So all the women in the worldwide, we have to educate the women. We have to give an awareness of the women. So they have to, non-modifiable factors cannot be preventable. Like you can recollect what are the non-modifiable factors. If they have like family history, like mother is having breast cancer, sister is having breast cancer, that cannot be modifiable. If the age factors more than 45 to 55 years, if they early menarche or late menopause, if they have gene mutation, that is a BRCA1, BRCA2, like that type of cases, we cannot prevent the diseases. The diseases will come. Early we have to detect, we have to treat the diseases. What are the modifiable factors? That factors we have to understand and we have to change it. Then we can reduce the risk of getting the breast cancer. Main thing, lifestyle. Lifestyle, we can ask the women of all the age group, they can go with an active exercises and reduce their weight. And another one is leaving of all the bad habits of alcoholism and smoking. That also helps in reducing the risk factor. And they can have a better childbearing and childbirth below the age of 35 years. That can reduces the breast cancer. And if the woman is delivered, if there is not having any problem, prolonged breastfeeding can be practiced for the women for the first child or second child or third child. That will be benefited for reducing the breast cancer. And they have any hormonal pills or hormone replacement therapy, they can be supervised in the clinical area, and they can find out they are having any risk in their future. And they can prevent the induced abortions. And these are the major preventive aspects they can done in order to identify the in order to prevent the breast cancer. So as a role of nurse, what is our role in breast cancer? So we have to move on with an awareness for all the women. Like awareness, I told, no, October month is celebrating as the breast cancer. It is indicated as the pink day. So each week we can give so much of awareness program in the community or in the clinical area, or we can conduct some classes in our colleges to educate for the students also. So they will be spreading to more number of people. And how means they have to go with the breast self examination. That is the cheapest and simple method that all the women can do regularly to find out anything. So if they are finding out any variations like changes of the breast, size or shape or symmetry, any color changes, any leakage of the nipple, any swelling of the nipple, any inversion of the nipple. So without shy or shame, they have to come forward to the clinical and they have to do the clinical examination. And nowadays we will advise the women after the 40 years of age group, 1 year once they can do the mammography also. So the mammography will best find out whether they are having a lump in the breast or not. So these are the early identification factors, and these factors we can identify and we can we can prevent the breast cancer. And if they are having the breast cancer, we have so many treatment modalities are there. Surgical treatment are there, chemotherapy, radiation therapy, target therapy. So the women itself, they should know along with the physician what is the type of breast cancer. So as a nurses, when they are diagnostic with the breast cancer, it's not a very happy process. It is a very emotionally factor for the women if they are finding out. So many women will think, if I have the breast cancer, I will die immediately. So if their stages is like that, so they have to identify what type of cancer they are having, what type of treatment modalities they have, what is the stages of cancer. So as soon as they are coming with the hospital, this stage, early stage, so the curable is more easy. If they are coming with the later stage, the curable is very difficult, even it can be danger to the life. So that the people has to be understand, as like in our developing country of India, they should be known aware about the breast cancer, what are the diagnostic modalities, treatment and the management. So then we can fight together and close the gap of inequality to finding out the cancer, and better results can be given. So these are the major nursing role in the prevention of breast cancer. So today in the class, we have discussed about what is the introduction of breast cancer, what is the meaning of breast cancer, what are the causes and risk factors of breast cancer, what are the signs and symptoms of breast cancer, and we have discussed about types of breast cancer, stages of breast cancer, diagnostic modalities of breast cancer, treatment of breast cancer, and prevention and nurses' role of breast cancer. Hope you all have understood about the today live section. So breast cancer, it is the second leading cause of death in the for the women. So this will be benefited for you. And again, I will come to a live section in another class. So today I'm signing off, Mrs. Nima. Thank you. You all can watch this on further classes from our channel rgcsk.edu. Thank you.